So in this section, we will be talking about mental health among essential workers in the healthcare workforce during the pandemic. Now, prior to the pandemic, a survey conducted in a nationally representative sample of close to 2 million workers from 2008 through 2019 already reported a heightened suicide risk for registered nurses, healthcare support workers, and health technicians, highlighting the need for concerted efforts to support their mental health. However, the study did not include other essential workers, including service workers. The COVID-19 pandemic certainly took a toll on essential workers in the healthcare workforce. Challenging work conditions put over 20 million U.S. health workers at risk for mental health problems, including stress, burnout, depression, anxiety, substance abuse, and suicidal behavior. Now, it's important to note that these mental health concerns are not new, as even before the pandemic, those working in the healthcare industry faced challenging working conditions and suffered high rates of poor mental health outcomes. But the pandemic certainly exacerbated these problems. Some of the challenging working conditions in this workforce included long working hours, rotating and irregular shifts, intense physical and emotional labor, exposure to human suffering and death, increased risk of exposure to disease and violence, as well as increased exposures to chemical hazards for some workers, which we will go into shortly. In addition to these pre-existing mental health issues that were exacerbated by the pandemic, a new level of burden was also seen among workers that arose from shortages in staffing and personal protective equipment, or PPE, as well as fatigue and loss and grief. In fact, as of February 2022, the Centers for Disease Control and Prevention, or CDC, estimated that there were over 929,000 diagnosed COVID-19 cases and over 3,600 deaths among healthcare workers. Now, prior to 2022, specifically between June and September of 2020, the national nonprofit organization Mental Health America conducted a nationwide survey. Respondents included workers in the healthcare workforce, including technicians and nurses. The majority of respondents for the survey were between 18 and 44 years of age and predominantly white. 80% of the respondents reported being in direct or indirect contact with patients, and 65% of them reported inadequate emotional support during the pandemic. In addition, over 3/4 of respondents reported experiencing stress, anxiety, emotional exhaustion, frustration, and feeling just generally overwhelmed. Additionally, among those who were parents, at least 50% of them reported lack of time or unable to support their children. However, one major limitation of the survey is that there was extreme underrepresentation. Respondents were predominantly white, and many work categories that entailed low-income positions were severely underrepresented. For example, only 7% of respondents were in the healthcare service sector, which includes housekeeping and food services staff. Unfortunately, most research on the mental health and well-being of healthcare workers has focused on physicians and nurses, with less attention being paid to other healthcare occupations, even though those in low-wage healthcare positions also had an elevated prevalence of a broad range of mental health-related concerns. According to the CDC, those in the healthcare service sector were 5 times as likely as other workers who diagnosed patients to say they had poor health. Food service and trade workers were also more likely than non-healthcare workers to say they often felt physical distress and had insufficient sleep, both of which can lead to poor health, including poor mental health. Now, the lack of adequate resources, stigma, and structural level factors have also exacerbated mental health disparities, especially in lower-income workers in the healthcare industry. During the pandemic, resources were heavily strained during and post-pandemic. Services were also not available to all, especially those at highest risk and who could not afford care. In addition, many could not afford to take time off, and as a result of this, many infected workers increased the spread of the virus faster than among the general healthcare industry due to lack of personal protective equipment, or PPE. And while there is a general stigma of seeking mental health in this workforce, it is highly prevalent among workers of color due to cultural level factors. Now, these same low-wage workers face multiple social determinants of health, many of which are due to structural racism and can exacerbate mental health, placing them at a disadvantage. Some of these factors include financial distress, living in polluted neighborhoods, as well as poor housing and working conditions, lack of access to adequate healthcare and health insurance, access to healthy foods, language barriers, immigration status. Many of them were being treated as dispensable, as well as no enforcement of worker rights and additional caregiving responsibilities that they were facing. Exacerbation of stress and mental health conditions is recognized to be linked with racism in the United States and cannot be ignored among workers in healthcare at all levels, and more so among those in the lower income categories. It is widely recognized that experiences of workers of color are exacerbated by ongoing systemic racism, and research has shown that racism is associated with increased risk for many poor health outcomes, including high blood pressure, insomnia, depression, and anxiety. And these associations remain even after taking into account socioeconomic status, gender, and age. Therefore, addressing mental health among those in the healthcare workforce is critical, including the most vulnerable, because of the possibility of future pandemics. Also, unresolved stress levels can result in persistent psychological distress. Worker experiences are also key in order for us to understand and guide the development of strategies to support workers through pandemics as well as the aftermath of such events. And lastly, all workers deserve a safe workplace, and strategies to eliminate all of these structural level barriers are critically needed in order to stop the perpetual cycle where marginalized communities of color are overburdened with workplace exposures and health disparities. It is also clear that culturally relevant strategies are needed and are key to improve mental health. Some of the protective factors critical for all workers include making sure that they have paid time off, making sure that they have mental health supports, that workers have a sense of workplace pride, in addition to providing workers with self-coping strategies and ensuring the provision of adequate PPE and worker safety training, which doesn't often happen in many low-wage jobs. Also, protective factors should not only be available to all, but we also need to ensure that they are racially and ethnically relevant to overcome cultural barriers and stigmas that are prevalent in many communities of color. For example, we need to ensure that there's proper language accessibility. There's also a critical need to address a stigma around mental health to normalize seeking care. This is true especially in populations of color where mental health is still taboo. We also need to ensure that we protect worker rights, increase knowledge in workplace safety enforcement. It is also key to leverage existing cultural community resources that are trusted by community members. For example, churches are a trusted source of social support for populations, including those in sociodemographically disadvantaged communities. It is also important to expand and diversify the mental health workforce so that patients can better relate to their providers and to work towards eliminating barriers in accessing care. Other suggested initiatives to mitigate mental health disparities can include improving workplace environments in a safe manner, for example, improving ventilation, filtration systems, as well as disinfection practices, and to provide PPE to all of those who are at risk, in addition to more inspections and tougher penalties by the Occupational Safety and Health Administration, or OSHA. And also empowering state and local public health agencies by providing them with the necessary resources to protect workers, as well as committing to protecting those who are disproportionately at risk.